All right, Doc. You get another question for us?
Yeah, so this one is less of a hormonal question. This is more, sports medicine question. So this will be different anyway. Hello, my name is Shay Smith, and I'm an ambitious 18-year-old who wants to learn more about bodybuilding and the science behind it. During the beginning of 2017, I became infatuated with the art of bodybuilding and the lifestyle that it entailed. However, on May 10, 2017, I injured my left elbow and minutely tore my tricep tendon. Due to that, I took several months off in hopes to recover it. Unfortunately, due to being inactive for too long, I developed tendinosis. Now, we talk about taking this time off and being inactive. You meant you just didn't do like your tricep extensions or something, but you were still doing your legs and other exercises, I hope. Anyway, I developed tendinosis in my wrist flexor tendon on both arms and discovered by an MRI that I had bone edema in my left medial epicondyle. What is your advice for the treatment of these problems, including everything from supplementation to physical therapy? I'd be flattered if you use my question in one of your videos, and it will help kick off my bodybuilding journey. Thanks so much. So, medial epicondylitis is more rare than lateral epicondylitis, what is normally referred to as tennis elbow. But bodybuilders get either a lot, or any weightlifters will say, anyone who's doing something manually, because even just racking the weights, okay, what do we do all day long? Just to grab the weight, whether you're doing something that involves extension or contraction, right, of the bicep in this case, or the tricep, you got to grip that thing, right? So you get, medial epicondylitis when the tendon starts to, never gets a chance to rest really. And it can occur from just an imbalance between the flexor and the flexor and the extensor, or overuse of one versus the other. It sounds kind of yin yang, but balance is definitely a big factor, whether it's balance between the bicep and the tricep, or the flexors and the extensors of the forearm. So the first thing I would do is do a little, an evaluation, to have the patient extend their arms and see how far they could bend back their wrist, and also forward to see, okay, how much how much flexibility do you have in those muscles, and then you can palpate, see how supple they are. Typically, guys will have, I don't know if you can see that, instead of a 90 degree, am I on the camera?
Yep.
It'll be something like this, and you go, that's it, So you do various stretches to increase that flexibility there, and it might be this way too.
Yeah.
Okay, you can also massage it, and I usually recommend about 2 or 3 weeks of working your way through the workout with straps if you have to, when you're doing pull downs or anything where you're holding it. And like if you're doing rowing action, you want to grip in what we call a neutral grip, because a lot of people will do this just, okay, it starts to get heavy, and some people will roll out and pull this way, some will roll in and pull this way. Okay, and that puts too much strain on one or the other, and I'm using them both kind of interchangeably because they are kind of interchangeable. It works. Some people get the extensors, some people get the flexors, but the idea is to stretch the opposing muscle. So in his case, it's a flexor. Make sure that the extensors are flexed, and this is kind of rare that the extensors are overdeveloped. But at any rate. Return them to their normal state. You could actually make use of, if he's got a doctor nearby, well, you could even make use of just some Advil over the counter, or I like to recommend, if you don't want to go the injection route, some diclofenac 3% mixed with some, say, 70% DMSO in a 50-50 fashion. And you just need like a half a pea grain of both, mix them together in the palm of your hand and apply it there. The DMSO would work on its own. The diclofenac is an NSAID. The combination works really, really well to decrease inflammation and get changeover of blood and nutrients, and get rid of the cytokines, all the things that are causing problems in the area, and help heal it. And then once it feels like it's healed, then start strengthening the muscles that need to be balanced. Okay, so typically, let's say with lateral epicondylitis, this is the weaker muscle, and this is the stronger one. So everyone's stretching this one, and then after about 3 weeks, you start to do like the wrist rollers. We used to make our own out of the broomstick, and start strengthening the extensors so that you get a better balance between the two, and then continue to stretch them so that they stay supple. One of the things that we forget to use is glucosamine. And you go, wait a minute, glucosamine, isn't that for joints? Yeah, 25% of the time, roughly all the studies come together and say you're going to get some benefit in your knee or your elbow or something from wherever you have cartilage from glucosamine. But as an athlete that uses muscles, which we all do as an athlete, it's way better for your muscles. The glucosamine creates something called glycoaminoglycans, or GAGs, which helps separate the sarcomeres in the muscle by bringing fluid in between there, so you're not going to get as many adhesions. Now, again, we're talking tendons, I get it, but tendon and muscle, where do you draw the line? Where does it become muscle or where does it become tendon? So it could definitely be helpful. And he's asking for advice for his bodybuilding career.
Yeah,
use your glucosamine. It's a good one, and it can also help with joints too, obviously.
Yeah.
For the bone edema, that one's a weird one. I mean, bone edema, again, I can't give advice over the internet, but I'd want to see the MRI and see what the read really is. Not downing the reader, or how what do they call it, telegraph, where it's been translated at least twice now from MRI to the reader of the MRI and now to this gentleman, Mr. Smith here. But maybe there's just a little bit of edema at the right where you've got the attachment there, and that'll go away. Is it bone or is it actually the tendon itself? I don't know, but that would imply maybe did you bang it on something? I don't know. That one's kind of a weird one. But the same application of DMSO and diclofenac, or either one separately, would be helpful. And then, of course, I forgot to mention, you could also find a doc who might be willing to inject some cortisone. I like to use triamcinolone or Kenalog. The thinking was in the past, and still is for some docs, hey, use cortisone as a last resort. Why? Because cortisone, while it decreases inflammation, it can also break down some of the so-called good tissue, so it can make a weakened area even weaker. Well, my thinking, and I'm not alone, there's other docs who are the same mindset, if you've given it about 6 weeks of what we call conservative therapy, you've tried everything, you've stretched, you've tried to strengthen, you've done icing. It's another thing you can always use. Ice.
Yeah.
Everyone hates to do it, but it works great, man. Icing works great. It's just a pain in the rear end. But 2 or 3 times a day, ice. That's conservative treatment. Along with anything else, though, it works. You can, that's just par for the course. But anyway, after 6 weeks of conservative therapy, if you haven't gotten any better, I'm more likely to give you an injection of cortisone then. Why? Because then it's not chronic and hanging by a thread. And so, I cure the inflammation, but I nick that last thread it's hanging by, and then we have a disaster that detaches, et cetera, which is what doctors are fearful of doing. And they'll even give you I've heard doctors tell people many times, not directly, but through the patient, you get 3 cortisone shots for life, and that's it. I don't follow that reasoning. That's why I'm explaining this. I'm giving you my reasoning for whatever it's good for. I'd rather get it while it's still relatively acute than chronic, so that if there is any damage caused by the cortisone, it's not going to wipe you out, and we get you back in action much more quickly, so that we're not that chronic inflammation feeds upon itself, man. I mean, there is some timeliness that has to be applied here. So. That's what I would consider doing. And whatever you're doing, that you minutely tore your tricep tendon, don't do that anymore.
That should have been the first advice.
One of the things I would consider is, I wish that we had more guys like this around, but find a guy who knows what he's doing in the gym. That's easier said than done. And see if you can find a mentor or whatever. There's stuff online now where there's trusted sources where. The old thing was you found the guy with the biggest biceps and you did whatever he did if you wanted big biceps, huh? Well, what we didn't know is he could have had big biceps just because he chose his parents well and he was doing all the exercises the completely wrong way.
Yeah.
So that's what can happen, especially in the early going, where you go, well, okay, let me try that. And he's doing some twisting motion while he's pressing through, and that can have a disastrous effect on the tricep muscle.
Yeah.
So.
I also think, though, because of the internet, sometimes you may have too much information, too much choice. It's a fine line between finding the right information and idiotic ones.
Yeah. Dr. Google, I run across him all the time. No, let's start over, back up. But yeah, well, that's the
Yeah.
rub, right? Is
Yeah.
finding the right information. But it is out there much more so if
Yes.
you can do the work and find the.
You got to
right
do due
information.
diligence. You're right.
Yep.
You know, and I want to say on that note that we're really glad we just had the gentleman a couple questions ago who was 65. This one's 18. I think it's great to have such a range. You know, so thank you for watching, you guys. We appreciate it.
Right on.
Thanks, Doc.